everyone. So in this video, we're going to talk about a very popular algorithm that has just been climbing the charts, and that's the Opioid-Associated Emergency algorithm. Now, we all know how bad the heroin opioid epidemic is in America, so we're not going to dive into that. However, we're the guys responsible for treating it, so let's focus on that. Now, how do you know that you might be dealing with a heroin overdose cardiac arrest? I don't know. There's a needle hanging out of his arm. There's drug paraphernalia at the scene. Everyone else in the room is stoned on heroin. This can be a dangerous situation, so remember your safety first when you're going into those situations. Now, why do people die from a heroin overdose? They stop breathing. That's the problem. Heroin, opioids, narcotics are all potent respiratory and central nervous system depressants. So the guy overdoses. He becomes unconscious. He's going to start breathing less often and with less tidal volume. The way he fell when he became unconscious may actually physically obstruct his airway. So the problem is the breathing. He becomes hypoxic. The heart becomes hypoxic. He begins to develop arrhythmias and ultimately cardiac arrest. That's the problem. So our best strategy for treating an overdose, just the overdose, get that airway open. Start providing ventilations with 100% oxygen, and as quickly as we can, administer the reversal agent, the antagonist for this narcotic, and that's Narcan. Now, there is no specific reversal dose for the Narcan because we don't know how much heroin they took. The recommended starting dose is 2 milligrams intranasal or 0.4 milligrams IV. Intranasal is very popular and preferred because you don't have to start handling needles and you can administer it very quickly. Now, that's the heroin overdose. Let's put that into the context of a cardiac arrest. We've gotten there and now the patient is in a cardiac arrest. Basically, we're working a standard cardiac arrest, except we're also going to include in our treatment the administration of Narcan. So let's take a look at that. First, we establish unresponsiveness like we always do. We're going to get help, call 911, and we're calling 911 because we're going to need more professional help and we need that reversal agent because I don't have any Narcan in my pocket. If they do not have a pulse, begin chest compressions immediately. It's a standard cardiac arrest. Apply the AED and defibrillate as needed. Run the standard cardiac arrest and administer Narcan as quickly as possible. Now, in an overdose, that first dose of Narcan you administered may work. It may reverse the effects. The patient may wake up, then become unresponsive again. So constant monitoring of the patient is paramount. Pulse oximetry, cardiac monitor, end tidal. Monitor your patient closely because you may, and you will find you often have to redose them with Narcan. Some patients require a Narcan drip when they get to the hospital. They've taken that much heroin. Okay, so the takeaway from this video, if the patient does not have a pulse, is not breathing, it's a standard cardiac arrest, except we're going to include the administration of Narcan. If the patient still has a pulse and we suspect an opioid narcotic overdose, get that airway open, begin bagging, and administer Narcan as quickly as possible. I'm Mark, thanks for watching. See you in the next video.